Welcome to Sandy Says. Today I will talk to Linda Stalters, CEO and founder of SARDAA. I work for SARDAA as the Director of Community Engagement. For over 3 years, I have worked with Linda. You are the founder of SARDAA. You also are a retired advanced practice registered nurse who practiced as a therapist, educator, and consultant. How did you meet Joanne Verbanek, the founder of Schizophrenics Anonymous, now Schizophrenia Alliance Psychosis Support and Acceptance?
Well, thank you, Sandy. Thank you for everything you do. You're an amazing person and really appreciate you and all the work that you do for SARDAA and for the people that you serve. And I met Joanne at the American Psychiatric Nurses Association meeting. Oh my goodness, in like I think about 1989 or 90 in Florida. And I went to a meeting that she was speaking at, and I was so impressed with the concept of a support group run by and for people with schizophrenia. And so I contacted her, and at the time I was working at the VA hospital in Washington, D.C., and I talked to the people, the patients on the unit, and we started an SA group at the DCVA, and then they wanted to start a group out in the community. And so I helped them start a group in Wheaton, Maryland that I think we started, and I should know this, but I can't remember. It was maybe in the mid-90s, it finally got started, and it still is active, and Dave, and the church where we set up a free room, gave us and Dave the key to the church, and they've had that key ever since.
That is wonderful. What was your experience like as an SA professional support staff?
Well, that's interesting because it gave me a totally different perspective of working with people who have schizophrenia and other psychosis, brain diseases, and a different perspective from not the clinical perspective, but I became more like a friend, and which was really great. And because people don't realize when they're treating people in the inpatient situation, it's very different than being able to be involved with people out in the community when they're doing better. And so it was a great experience. I learned a lot, and I learned a lot about how to effectively start a group. And I found that as a clinician, it was challenging to make sure that the people in the group realized that was their group. I wasn't their leader. I wasn't the person that makes the decisions. It's their group. And it was difficult for them to let me go after helping to model leadership for the group. But I would always remind them when they'd ask me, well, can we do this or can we do that in our group? I would reflect back to them, well, what do you want to do? This is your group, not mine. But I loved it, and it gave me a totally new way of being with people.
Why did you decide to start SARDAA?
Well, in 1997, in 2007, another organization that was the core support and administrator for SA ceased doing business. And at that time, MHA National was taking over SA, schizophrenia, was then Schizophrenics Anonymous. And then after a year, I moved from where I had my private practices in the Washington, D.C. area, I moved to Houston, Texas. And after being there for a few months, I called Joanne and I said, you know, we really need to start a new organization because MHA was not taking care of SA. As a matter of fact, most people in the SA groups thought that because the other organization folded or ceased doing business, that they couldn't continue their group, which, you know, is not the case, but they didn't have an administrative group. So I said, we need to start an organization that's more than SA. It's really an organization that does SA and other things to help people with schizophrenia that other people aren't doing. And to expand that, it's not just schizophrenia, because it's psychosis that really makes the difference, the different experience that other people don't have. And it's very unique. And it's unique among the people who live with these brain illnesses. So Joanne was delighted, and we set up a steering committee in January of 2008. And that steering committee consisted of people who have the disease, including Dr. Fred Fries. We all loved him dearly, and an attorney, other caregivers, and other patients or people who live with the illness, and professionals. And so we determined, it was very difficult to decide what to name the organization. I would certainly name it something different now than we did then. We would definitely have the word brain in the title. But at that time, in 2008, you know, we would have liked to have had it the Psychosis Alliance or support group, or the Psychosis Alliance of America. But that was too scary in 2008. And we did ask other people, you know, in research organizations. And I said, I know things are going to be changing, but so the best we could do was Schizophrenia and Related Disorders Alliance of America, which is way too long. But so that's where it started. And I'm proud to say that we're doing some incredible things now.
Who came up with the idea of doing conference calls?
I did right away within 2008. We started with family members because there's so many people who are too overburdened with everything that they have to do that they just can't get to another meeting, but they need the support among people who have the same experiences. And then we started the SA groups, and we started out with one group with 2 people. And now we have, with SA and FFC, I think we have 12 groups that meet, including the Zoom groups, a week.
Yeah, I know it's hard to believe, you know, for me, I found SARDAA back in 2013 in the conference calls, and, you know, that wasn't that long after y'all had just founded it. But I can tell you, when I was on those calls, I mean, the SA group leaders are phenomenal. You know, you felt like these people had been doing this for years. And I know one of them has been with us for 25 years, you know, so as a face-to-face group leader. So it's just amazing to me and how dedicated they are.
Absolutely.
And who came up with the Blue Book?
Well, that was Joanne, and earlier SA members created the Blue Book. And I really loved the first Blue Book cover that was designed by David M. And, and a beautiful piece of work, but people decided to change it. And so we have only just kept the Blue Book, and it's called a Blue Book because it's blue. and and just, you know, updated things as we go along, to just like anything over the years, things change.
And for people who don't know, in the Blue Book, we have the 6 steps of recovery, which is based on the 12-step program that Joanne got permission to use, and she modified it for people who have schizophrenia. And I know our members, you know, live by those 6 steps and talk about how much it's really impacted their life.
And I
So
can
what?
I'm sorry.
That's okay.
I was just going to say, and Joanne, she lived by those as well, and she is now deceased, and she, even when she was experiencing symptoms, she would go back to the 6 steps, and she would reach out when she was having challenges, and she would be the first to say, even if you are adhering to your medications, you need to stay close to your clinician, and reach out to your support group to really help you. And some people have said they go back to the first step and go to their support group and say, I'm going to the first step, I need help. Please help me to get to my clinician or to the hospital, or what should I do? And they will help people get back to their clinician, which oftentimes, and you can say, your experiences, it might be easier to hear things from your peers rather than your caregivers and your clinicians.
Linda, what accomplishment as CEO of SARDAA are you most proud of?
Oh my goodness. You know, that's hard to say. I think growing the SA groups and being the first of all the other organizations to have the virtual groups, so that more people can get support specific to their symptomology, and so that they can feel that they, and know that they're not alone with what they're living with, and to help families who are struggling with when their child is first exhibiting symptoms and they don't know what to do, and so helping them. And really, you know, our initiative to reclassify schizophrenia spectrum as a neurological brain illness, I think when we truly accomplish that, and I know that we will, we've moved forward quite a bit, and we have a lot of people who are including scientists and psychiatrists and family members and people who live with these illnesses, that know that this will truly change how people are treated, both medically and socially, and receive more respect, have more research money, so that we can get better treatments and support. I think that pretty much sums it up. When even when I hear just one person, I mean, I just got an email from someone who has been involved with SA for years and years, from the very beginning, who has written some really important pieces that we use and we still use. His name is John, and he, when he expressed such gratitude for keeping SA going, that was profound for me, because this is really a heart-driven organization. And I too want to say to you, Sandy, you are an amazing person and
Yes.
such a role model for so many people. You have gone from homelessness to leadership. And I'm so proud to have you as a member of our board of directors, as our director of community engagement, and all of the things that you are doing. And even while you are pursuing your master's degree, I want to say thank you so very much.
Thank you, Linda. And thank you for joining us today. Please subscribe to the SARDAA YouTube channel so you get notified when we release the next Sandy Says. Have a great day.